to our program of Aprender a Estudar em Casa. I am Linda de Barros, your English teacher. Dear students, are you ready to start our class for today? Can you look at the board and tell me if you can guess about what we are going to talk today? What is that? Do you know the name of that object? Yes, that is a stethoscope. And who is the person that uses this object? Is it a cook? Or is it a teacher? A fireman? No, of course not. The person that uses this object, the stethoscope, is a doctor. Of course. So, if the doctor is the one that uses this object, it means that today our lesson is going to be about hospital. Let's look our agenda at the board. Today we're going to learn and identify health vocabulary. Talking about the hospital, the vocabulary that are related to hospital and health. And also, we are going to mention some types of disease, okay, and explain the symptom. Disease or health problems. That's why our agenda is explain symptoms and common health problems. Let's start looking at the board what we have now. Today we're going to move to unit number 4. Okay? Now, what we have? Look at the picture. Do you see a man? He's catching the belly. It means that the man has some problem with his belly or his stomach. Okay? Where do you go when you are ill? What means ill? When you have a problem, it means you are ill or you are sick or you have pain. This person seems to have a pain in the stomach. That's why he's making this. Okay? Where is the place that the person goes when we feel something, some problem? The place is hospital. Sure. We go to the hospital. We can go to clinic. Or we can go to health center. In our country, we have main health center in some zones. But we have also our central hospital, Agostinho Neto. And there are also main clinics that people can go for to make the treatment of health. Who are these? Can you tell me? This is a patient. And that is a doctor. Who is a patient? The patient is the person who is sick. When you are sick, when you feel some problem with your body, you go to the hospital. It means that you are a patient. And the person that examines you and help you with the treatment is a doctor. Okay? The person that helps you to recover your health is a doctor. Let's see now what we have. This is a nurse. Who is a nurse? Nurse is the person, can be a woman or a man, that takes care of the patient, helps the patient when they are at the hospital, okay? That is a porter. Who is a porter? Can be a woman or a man that cares the patient or that cares the equipment in the hospital. Okay? When the patients are unable to walk, the porter helps them and moves them in the hospital. And now, let's see. At the doctor's office, what happens at the doctor's office? The doctor examines the patient at his or her office Yes, because doctor can be a man or a woman at his office or her office. Examine the patient, and then what does she do or what does he do? Then, after examining the patient, the doctor prescribes the medication. When the patients are seriously sick, the doctor admits them. They stay in the hospital. This means to be admitted. When you are seriously sick, you stay in the hospital for some days, 1 week, 2 weeks, or a month. It depends on the problem you have. Okay? Staying in the hospital means to be admitted. Then, remember that the doctor examines the patient and prescribes the medication. If the patient stays in the hospital, if the patients are admitted, who is the person that cares about the patient? It's the nurse. Remember that the nurse is the one that cares about the patient. The nurses, they are in charge to care about the patients, to give the medication, okay, on time, on the correct time, to help them whenever they need in the hospital, okay? Let's see some types of medication. Let's see, the medication can be, or these are some types of medication. Medicine or pills, okay, that are some types of pills. For example, paracetamol, aspirina, these are some types of medication, you know them. Injection, sometimes people need to take injections, okay? And this is injection. Creams, when we have problems with our skin, the medications we take are some creams that we have to put in our skin. For example, if we have allergies or some other problems. And syrup. Syrup is used most of the time for children or for babies, okay, because they can't swallow the pills, so they use the syrup. And it's for cough and some allergies or infections. But then we are going to talk about some types of disease or illness. Let's now see, how do we say these items or these things in English? We know that this is a symbol of hospital. Whenever we look at ambulance, we remember about hospital. We think about the hospital, okay? This is the vehicle that transports sick people to the emergency. And that is the place where people buy the medicines. We can call drugstore or pharmacy, okay? Let's see more. What we have now, receptionary. This is the first place that you arrive when you go to a hospital. You go to the reception area, you find a person that guides you to the nursing room and then to the doctor's room, okay? Then we have emergency room. This is the first, the place where, or the room where the patients are taken when they have some urgent problem, okay? Now let's see then what we have. Operating room. When people, patients have serious problems, they have to be operated. There is a specific room at the hospital that the doctors can do this job. And this action is done by the doctors that are called surgeons. Can you repeat? Surgeons. Very good. The surgeons are these ones that operate the patients. And then we have the hospital bed. That is called hospital bed. Okay? Let's go on and see more. Remember, I told you we were going to talk about some health problems or some disease. You can say disease or illness. Repeat, disease or illness. Illness. Very good. These are some examples. There are many kind of disease in the world. Okay, I wrote some specific one that is most common that everybody knows, even you. I know that you have heard about these types of disease. We have the first one, flu, and we have cold. Flu and cold, they are a little bit different, okay? They have almost the same symptoms, but they are different, okay? The symptoms of the flu is more dangerous or severe than the symptoms of cold. You catch a cold when you are in a place that is warm or hot, and you go to a place that is cold. So you catch a cold. You start coughing, maybe you have a headache, and some fever sometimes. Or you have blocked nose, okay? You can sneeze. This is sneezing, okay? But flu is more dangerous. Okay, the symptoms is more dangerous than cold symptoms. Flu can come with the infection of your respiratory organs. Okay. Gastritis. Gastritis is the problem with your stomach. If you don't eat on time, if you eat too much sweets and you drink too much soda, okay, you can get this problem. Stress. We know that everybody now work a lot. Your parents maybe, they work a lot. They work too much from morning to night. We don't have much time to rest. That's why we get stressed. Our brain gets so tired and our body feels exhausted. That's why we need time. We need to take the time to rest our brain and our body to not get stressed, because there are some symptoms and some consequences of the stress and all the other problems. Diabetes. Everybody knows what is a diabetes. If you eat too much sugar or sweet things, candy, lollipop, sweet popcorn, okay, don't eat or drink too much things that are sweet, because you can have diabetes, okay? Infection. There are many kinds of infections. You can have infection on your respiratory organs, okay? Your lungs, your nose, okay? You can have infection in your mouth. You can have infection in your skin or in your sexual organs, okay? The infections is caused by virus, and we have to avoid, okay? Look, the word allergies. Allergy is a type of disease or a disturb that is caused by many different factors, okay? Maybe because of the type of dress that we wear, okay? Maybe because of the food or drink we eat or drink. Maybe because of the dust in the air. When you breathe, you feel allergies, okay? Now we have hypertension or high blood pressure. What is this? We know that in our country, many people, adults, have this problem, hypertension or high blood pressure. This problem is caused by eating too much fat or salt in your food. That's why you shouldn't eat too much crispies or chips, matutano, because they contain a lot of salt, and this may cause high blood pressure on you. And the foods that contains too much fat, okay, like hamburgers, hot dogs, and some fried things that I know you love to eat, or many adolescents, they love to eat. We must avoid this kind of food because they can cause us hypertension or high blood pressure. Remember, I talked about flu. Everybody knows that Cape Verde and the whole world is facing one type of flu, one different or new type of flu. What is the name of this flu? I know that you know. It's COVID-19, coronavirus. This is a type of flu that is surrounding the world. It has taken or killed many people around the world. And we are still fighting it. That's why we must take caution. What is COVID-19? It's a virus that causes respiratory infection. When a person has COVID-19, this person has a respiratory infection, the person can't breathe, the person has many other complications that can lead this person to death. That's why many children, especially a lot of old people, are dead now because of this virus. Because the children and the older people, their immunity system is not strong enough to fight the virus. And the young people are the stronger one to fight the virus. But we have to take some cautions or many cautions to help our body get stronger. But we will talk about it soon. Let's see now some symptoms of the disease we have mentioned before. We talked about flu, and these are some symptoms of flu. Fever, cough, sore throat are some symptoms of flu. They are not the only one, but they are some symptoms, okay? The most common. Remember that flu can bring respiratory infection. And when your body has a high temperature, you feel cold, it means you have fever. And you can feel pain on your body too. This is a symptom of flu. And coughing, when you do this, this is cough, okay? Sore throat is the pain that you feel in your throat, okay? And you can swallow even water sometimes. We talked about gastric. Stomach ache is one of the symptoms of gastric, okay? Headache, when you feel pressure in your brain, okay, it hurts you, this is headache. Sometimes you can't even open your eyes because of the pain that you feel. Now we see lose of weight and feel very thirsty. These two symptoms are the ones that comes from diabetes disease. If you are feeling very thirsty, most of the time or very often, go to a doctor and check if you have or not diabetes. Okay, when the person has diabetes, they start losing weight, and there are some people that have diabetes and they get too fat. Okay, fever and headache may be the symptom of allergy or infection as well. Because if you have infection, you feel fever and you have the headache. And also, the symptom of allergy can be sneezing and blocked nose. When you have allergy, for example, in your nose, okay, you sneeze, you do this. This is sneezing, okay? And your nose can be blocked and you can't breathe. This is the way you do when you have blocked the nose because you can't breathe correctly. These are the symptoms of the disease we mentioned. Now let's talk about COVID-19 prevention. Remember we talked about COVID and we saw that COVID-19 or coronavirus is a virus that causes a respiratory infection on our bodies. Which are the ways that we do or the things, the cautions we must do to prevent this virus? One of the first cautions we must take, and as you can see, all the teachers that come to aprender a estudar em casa, they always remember you all the time to wash the hands, sanitize the hands, or wear the mask. It's wearing the mask. We must, okay, it's an obligation. We must wear the mask when we are in public places like school, bank, walking on the street, or when we are with other people, okay, that are not common, that doesn't live with us in our house, okay. Sanitize the hand, alcohol gel, all the time, okay. Whenever we touch something, we must sanitize our hand or wash our hand with soap and water. To keep social distance. Social distance, when you go to a store to buy something, to supermarket, you stay away from other people. And when you are in the bus, You stay away from the other people at school, stay away from your colleagues, okay? And your teachers too. Eat healthy food. This is a very, very important item because if we don't eat healthy food, our body stays weak and we don't have enough power, enough immunity to fight the virus. We must eat fruits and vegetables and drink a lot of water, okay? To get a healthier body, a strong immunity system. And as well, we must do physical exercise. To walk, to run, okay? We must do some exercise every day. You can do it at least 5 or 4 days a week. From Monday to Friday, it's good, okay? If we take all the cautions and we eat, especially, we eat healthy food, okay? We prevent ourselves and we prevent our family, our school friends, okay? And all the people that surround us. We avoid contaminating with this virus. Now is exercise time. Let's see our exercise on the board and check if you can match the problems, okay, with their correct treatment. Can you read with me? Match the problems with the right treatment. Look at the problems and the correct treatment for these problems. Broken leg, a burned hand, a long cut on the shoulder. Let's see which one is the correct treatment for these problems. You should get some stitch, you should put ointment, you should use crutches. Let's continue. A swollen knee, a broken arm, a stomach ache, a rash. Which one are the correct treatment? You should put a cast, a bandage, you should take some pills, you should get an injection. Take your time and do the exercise. We will come back very soon. Now it's correction time. Let's see what did you do. 1, or the first one, a broken leg. What is the correct treatment for the broken leg? You should use a stretcher to help you walk with if you have a broken leg. A burned hand, what you should use? You should put ointment, okay, on your skin to help it to recover. Long cut on the shoulder, you should get some stitch. Next, a swollen knee, you should get an injection, okay, to help with your problem. Broken arm, you should put a cast, very good. Stomach ache, you should take some pills. A rash, you should use a bandage to protect your skin. Very good, you did an excellent exercise. Now let's move to exercise B. What health problems do the following pictures describe? Look and see what are these pictures describing. Take your time, we'll come back soon. Now let's see if you did your exercise correctly. Look, the first picture. What is the girl doing? She's sneezing, okay? And what is the boy or the man doing? In the second picture, he's coughing. Oh, he has a cough. Next, we have a man. He's making this. It means that he has stomach ache. The last one, the person has a cast on the leg. It means that he has broken leg. Very good. Congratulations. You are very smart. Dear ones, now it's homework time. Look at the board and see some images, okay? What are the people doing in the image? And based on this image, okay, you can create a story and present the story to your class. Good job! If you have a doubt, talk to your teacher. Now, love the students, is summary time. It's the time to check if you have learned something from our class of today. Today we talked about at the hospital, Unit 4, and we mentioned some vocabularies related to it, like healthcare, disease and symptoms, okay? And we talked about vocabularies such as reception area, emergency room. What are these? These are part of a hospital. We mentioned nurse, doctor, and porter. These are people that help the patient at the hospital. Medication and drugstore. Drugstore is the place where you buy medication. Flu, diabetes, and infection are some types of disease that we mentioned. Fever, headache, and cough are some symptoms of the disease we mentioned. What is a medication? Medication can be pill, cream, injection, or something that the doctor prescribes to the patient to treat them, to make them recover their health. Excellent! You were paying attention and you did a good job. I enjoyed your presence and your participation in our lesson today. My loved students, now we have finished our class of Aprender a Estudar em Casa. I really appreciated your presence and I enjoyed your participation. Goodbye. See you next class.